whoever walks in my clinic, I want to be able to treat them as best I can. And if you get stuck in one model, there's a large proportion of patients that you're just not going to be able to treat. So primarily I was a manual therapist. So when I would see patients, I would always get my hands on them and do joint mobilizations and manipulations. And I learned pretty quickly that I wasn't getting everybody better, but I didn't know why. And then as I get exposed to different things, suddenly there's a little cohort of patients I wasn't getting better before that now I can get better because I've seen another approach. So when I did the McKenzie stuff, I found that really useful for a bunch of spine patients that weren't getting better with just the Maitland approach. So I've always tried to sort of put it all together, though, in a non-guru way. I don't really like following gurus. Gurus have a lot of rules, and I sort of think I don't really like following rules. And I think that if you get locked into rules, again, you lose your lateral thinking. So what happened to me was I thought I had been trained at one of the best fellowships in the world, which at the time it was sort of considered one of the better ones. So I had a bit of a chip on my shoulder. I thought I was pretty good. And then I've been out about 10 years and I thought, I've got a fair bit of experience and I've been trained really well. So when I would get exposed to sometimes different approaches, I would, instead of really relaxing and opening my mind and thinking this could be something completely new, I would always be trying to fit it into what I already knew because I thought I knew everything back then. And I wish I hadn't had that chip on my shoulder because I would have got exposed. I would have gone and done Shirley's fellowship, for instance, a lot earlier. But I did have that chip on my shoulder.